Thanks, Rachel, for joining me today. To kick us off, do you want to introduce yourself?
Yeah, so I'm Rachel. I'm one of the managing directors of Health Engine. I'm a junior at Berkeley studying math and computer science right now. Health Engine is a student-run accelerator that works with early-stage projects in healthcare. We don't focus on founders from a typical university, although some of our alumni do hail from Berkeley. But we focus on founders that are building in health tech. So they can be from all over the world, can be in different stages of their life, just with the unified goal of building something really cool to improve people's lives and kind of solve the mess that is healthcare today.
Cool, great overview. And one other thing that I saw on your website is that Health Engine is run by the Phoenix Consulting Group, which is another student-led organization at UC Berkeley. How would you describe the relationship between those two organizations?
Yeah, so Health Engine was founded by a group of Phoenix members. So Phoenix Consulting Group was the group that has been here longer. It's the kind of big healthcare consulting group for undergrads at Berkeley. And back in 2020, a couple of students from Phoenix actually thought, hey, what if we start a startup accelerator in healthcare? You know, we have a lot of kind of projects with different pharma, biotech, small to like large corporations in healthcare, kind of with this network and with this knowledge that we have. And there's like a tremendous ecosystem for entrepreneurship in healthcare right now. Like, let's start an accelerator. And so these students founded Health Engine in kind of 2020 is when it really kicked off. And so we've been around since, and up until recently, Health Engine's kind of internal team was sourced directly from Phoenix Consulting Group. And so members of Phoenix Consulting Group that maybe finished with their consulting projects or kind of didn't want to do consulting anymore and wanted to kind of work on something else would work on Health Engine. But this past semester was the first time we recruited for students outside of Phoenix. And so we did like a recruitment process that was separate from Phoenix's recruitment process. And we, directly interviewed people from outside of Phoenix. Lots of undergrads were interested. And so that was really exciting. And we have like a team of around like 10 to 13 right now. Yeah.
Cool. Let's start with questions directed to help healthcare founders that are considering applying to Health Engine. Can you give an overview of the admission process?
Yeah, so we accept startups twice a year for our 2 batches. The first one is in the fall. That application comes out sometime around July. And the second batch is in the spring, and that application will come out sometime in December or January. And so the next time you can apply will be this upcoming December or January. After you apply, so the application itself is a series of questions. We'll ask you things like, how did you come up with this idea? What unique insight do you have into the problem you're trying to solve? Who are the founders, and why are you guys the best team to solve this problem? As well as if you've raised funding from anyone, how much and from who? How much progress have you made on the product? What stage is it at? So that's a rundown of basically everything we ask in that application. And then from that, we'll screen through and then select some startups for interviews. And the interview is a conversation with myself and then other members of the team. We'll ask you questions based on your application, kind of dig deeper into some questions that we might have, as well as really get to know the team better and see if you all would be like a good fit for our kind of community and the resources and program that we offer. So yeah, that's it. It's just two steps to the application process, and then you'll find out and join our community. And we accept small batches of startups, so we only accept around 6 to 9 startups every batch. And we do this because we want to one, not spread our resources too thin. We are student-led, and so our team isn't super big, and we have resources that are only applicable to really certain startups that are working on specific problems. And so we want to make sure that you would actually get value out of the program. And then second, we pride ourselves on kind of a tight-knit community of health tech founders. And that's kind of hard to do when there's, hundreds of startups in one batch. And so we like to keep things small and keep it kind of intimate and personalized. Yeah.
Cool. And what makes a startup a good fit for Health Engine? Like, what are you guys looking for during the admission process?
Mm-hmm. So one, because we're working with kind of very early stage founders, the first thing that the overarching thing that we look at is whether we think there's a good fit with the founders, whether the founders would be active in our community, whether they would have good synergy with other companies in our portfolio, or with our mentors, and whether they are, passionate about healthcare, and like this would be a community that they would really enjoy being part of. Um, and so that's one thing. And then I guess second that comes to mind is really what problem they're working on, and how they're trying to solve it. So we tend to kind of work with a lot of startups that are using tech enabled solutions, whether it's like software, like software to kind of solve healthcare administration problems, or care delivery problems. If you're a startup that's working on some kind of tech enabled solution to solve those problems, you'd be a great fit. We don't particularly work with therapeutics, or like biological drug development companies, or anything that is very heavily regulated, such as medical devices and drugs. So yeah, that's kind of the two things that we really look at while we're screening for startups.
And then what stage are most of the startups that are applying to your program? Like, do most of them have funding? Do most of them have just a product? Or are they just at like the idea stage? Like, where are they at?
So most of them have to have an MVP. So they can't just be like the idea. We don't work with that early stage of founders. So they do have an MVP. A lot of them, in terms of funding, have just finished raising a seed round, or a pre-seed round, and are looking to raise a Series A, or they might be in the midst of raising a seed. So that's kind of like the stage at which our founders are usually in. Although there are some outliers, we've accepted companies in the past that were in the process of building their MVP, and we've also accepted companies that have already raised like $15 million in funding. And so there's definitely a range. Yeah.
Cool. And then I was looking at your website and I saw the program consists of a weekly stand-up. There's a grants aspect. There's workshops, clinical connections, and more. Can you share more details about just like how the curriculum is structured and what you guys cover?
Mm-hmm. Yeah. So I guess I can talk about it from a week-to-week basis. So every week, our startups have a stand-up on Mondays usually. And so during this kind of 30 to 45-minute stand-up, our founders gather together. They share updates about what they've been working on and any asks or discussion questions they have. And this is a really important part of our community. Like I said, community is like a really big part of our mission at Health Engine. And we're really trying to create a space where founders can candidly talk about the problems they're facing. And because they're all kind of, working with providers or payers in healthcare, they have a lot of things to talk about. And so this is a great space for discussion. And then on Wednesdays, we bring in a speaker or host some kind of like activity or event for the startups. Our speakers are, successful founders in health tech. Most recently, we had one of the co-founders of, Hippocratic AI come in to talk to our startups. And so you can see that on our social media. We update that every time a speaker comes in. We have like our mentors, so mentors in our network will come in to give workshops or maybe give feedback on pitches. We'll have industry experts, like VPs at like top, like top companies in healthcare, or at like big tech companies that are trying to break into healthcare, kind of talk about their view on the industry and what like healthcare and health tech will look like in the future. So there's a range of topics and a range of different speakers that come in, but we all try to curate it to be useful for the specific batch of like 6 to 9 startups we're working with at the moment. And that's on Wednesdays. And then at the end of the entire kind of 3-month program, we have a demo day. And at this demo day, we invite people in our investor network. We invite people from Berkeley and our partners and mentors. They all come together and like kind of listen to the pitches of our cohort. And that's where, you know, startups that are looking to fundraise can get new investor connections. And yeah, we also try to host like some kind of events and like in-person mixers for our startups so that they can, you know, feel integrated into a community and just like go to meetups where they can talk about, you know, like founding and healthcare with other folks. Yeah.
Cool. And what do you see as like the biggest opportunities to improve Health Engine in terms of how you guys support founders?
In terms of improving, I think the biggest thing that comes to mind for our internal team is just knowing more about healthcare. I think domain expertise is something that we kind of screen for when we interview potential people to join our internal team. So this is Berkeley students like myself. And so we want to really be a team of students that can actually provide kind of feedback or useful information to these founders. So that's one area that we're always constantly trying to improve on. And I think that also just is along the lines of we want to be a team that is always learning about the space. And then I guess for the program kind of at large, I mean, we want to get to a point where we do really great work with our startups and startups just kind of apply to Health Engine without us kind of reaching out. We did start kind of a couple of years ago. And so up until now, we really haven't had like a lot of a big network or, you know, past precedents like success to kind of attract startups to us. We've been like reaching out to like thousands of startups to apply. And so reaching that point would be great. And I think it would be a kind of reflection and testament to good work that we do for our startups. Yeah.
Cool. And then I was wondering if you could talk about just like some of the startups that you've worked with in the past, and then how do you engage with the alumni that went through the program?
Yeah, so we've accelerated 4 cohorts so far. We're currently in our 5th. And so in total, all of these companies are, it's 36 companies. And so I think all of them are super interesting. For example, one of the startups in our cohort right now, they're working on integrating AI solutions, such as, you know, AI solutions to detect like diseases or, you know, read X-ray images. They're working on integrating those solutions into hospitals. And so there's like a big barrier to hospitals adopting AI and tech in their systems because they're not tech companies. And so one of these companies in our cohort is working on that problem. They're the ones that raised a pretty big seed round recently. I think they're pretty cool. We also have companies that are working on kind of like the consumer side of healthcare. One of them from a couple cohorts back was working on a personalized ADHD coaching platform for people who have ADHD. And the founders themselves were actually recent graduates of Berkeley and Stanford. And then they have ADHD themselves, and we're kind of working on a better, you know, solution for people with ADHD that isn't as expensive and is more personalized. So yeah, those are kind of 2 companies on kind of opposite ends of our spectrum in terms of like what kinds of startups we work with. One is like very, you know, like selling to hospitals, and then the other is selling to kind of consumers and working on a digital app. Yeah.
Cool. And now I want to transition to questions to help students who want to join the Health Engine internal team. Can you give an overview of like that application process and what you guys are looking for? I know you mentioned domain expertise is one thing that you're screening for. What are some other things that you're looking for during that process?
Yeah, so domain expertise is one factor. The other factors we consider is, have you built anything in the past? Are you just naturally kind of passionate about building and kind of owning your own things? I think a lot of the work at Health Engine is reliant on these people who are very proactive and and like to take ownership. And so that's definitely one thing that we look for and ask in our interviews, I think. And the other one would just be, a passion and interest for either entrepreneurship or the health tech kind of space. And so if you're able to exhibit any of these qualities, we definitely, it's like rare to see candidates who like have everything, right? And so even if you don't have per se like a really strong domain expertise in healthcare, definitely don't want to discourage you from applying. We have team members, like some of our, like team members who are leading the team right now didn't actually come into Health Engine with a whole lot of healthcare experience or background, but they were really passionate about startups and building things on their own to support startups. And so, yeah, those are the kinds of things we look for. In terms of the actual process, we recruit alongside Phoenix. And so kind of whenever Phoenix starts recruiting, which is when typically consulting clubs at Berkeley recruit, is the beginning of every semester. That's when we also open our applications to the internal, to recruit for internal members. One caveat to this is that we don't actually recruit every single semester. We keep our team small. And so when we do feel a need to recruit members, that's when we kind of open applications. And I would actually encourage anybody who's like interested in applying to just apply and reach out to one of our like MDs or directors. It doesn't have to be during the recruiting cycle. And we always just want to know like who is interested in working with us. So there's that. And the process is pretty straightforward. It's submit your resume, we ask some essay questions, and then we interview you and have like a conversation where we get to know you. Yeah.
Cool. And then as you onboard new team members, how do you train them to give good advice and be helpful to the startups that you guys are working with?
Yeah, so this is actually a question that we always kind of ask ourselves every semester. Like, are we really providing good training for our new members? And are they providing value to our startups? So it's definitely something we're still working on since we're a pretty new organization, and we've only really started recruiting new members this semester. But one thing we like to do is our Slack is very active. And so outside of synchronous meetings, people are always sharing like articles and like interesting things they were thinking about in the Slack. And so I think first and foremost, we really emphasize this culture of we want to be kind of like drivers of each other's, personal growth and learning. And, we do that through meetings and through the Slack and through just generally discussing, ideas we have and things that we care about. And so I think by facilitating this culture, it's been beneficial to really understand like each internal team member's like strengths and like what they like to work on. And maybe in the future, we'll have like a more formal education program where we kind of like make them go through, stuff that they need to read, stuff that they need to know. We don't have that in place yet, but we're just trying to, uphold this pillar of kind of, everyone should be learning, everyone should be kind of contributing to each other's like growth and understanding of the healthcare space. Yeah.
Cool. And then last question, is there like anything I didn't ask about that you think is important to know for a founder considering applying to your accelerator or someone who wants to join the internal team?
I think if you're interested, I think don't be hesitant to like reach out. We're not like I think kind of contrary to a lot of the bigger clubs on campus, we're a lot more informal with our process of bringing people on board. And so you don't necessarily have to wait until the beginning of the semester when recruiting season starts to reach out to us. So definitely reach out. And then also, if you're interested in entrepreneurship or kind of what are the new ideas and problems that people are working on in healthcare, I think Health Engine is probably like the best place to do that at Berkeley. Our internal team members get access to the founders, first of all. They work really closely with them, and like meet them every week, meet them at the stand-ups and workshops. So you really interface with founders very frequently, and hear about their day-to-day kind of like problems that they're working on. And second, you get to build a network of people in entrepreneurship. So whether that be VCs or other organizations at Berkeley that might be, they might be accelerators or incubators themselves. But if you're interested in like, venture capital and entrepreneurship, I think Health Engine is really unique in the sense that you can like pave your own way to build that network for yourself as well. Yeah.
Sweet. Thanks, Rachel, for joining me today.
Yeah. Thanks for having me.